what's the certainty that we can, in a capitalist society, solve the supply chain for vaccine distribution?
Well, first of all, thank you for inviting me to be on your program. There is no assurance, but the one difference is that we have a lot of time to think about this. It will be months before a vaccine is available. And so we have time to give careful thought to who should be in the priority groups and how we should distribute the vaccine in order to get it to those priority groups. So that is why me and my colleagues started working on this issue actually a couple months ago. Why we've issued a report now, even though we don't expect the vaccine to be around for another 6 months or so.
When we talk about setting up those priorities, people listening could probably say, well, I could probably come up with a list in my head, and it was probably great that the medical community would lead that prioritization. But with so many things during this pandemic, things have become politicized. Is this the danger here, that there'll be best practices and best advice from the medical community and politicians will override it and set their own agenda?
Well, that is a danger, of course. And so the way that we try to counter that is by having a rational, ethical approach to this and making it public and trying to actually encourage the public to get involved in the ongoing discussions about this, so that if there is, if there are recommendations that don't seem right in the people's minds, we have something to point to.
So, Dr. Toner, if you could summarize the conclusions of your study for us.
Yeah, so just to walk through very briefly, we started with very broad ethical principles and work our way down through a framework, a process to get to the actual groups. And so we proposed 2 tiers of people who should be vaccinated above the general public or before the general public. And in the first group would be those people who are essential to sustaining the pandemic response. And so that would be healthcare workers who are providing direct patient care to COVID patients. It would involve EMS workers. It would involve people who are doing the vaccinations. And it would be public health people who are on the front lines interacting with the public, but also be people who are at greatest risk for COVID-19 or bad outcomes from COVID-19. So people over 65, people with certain underlying health conditions, particularly those who have multiple underlying health conditions, people working in nursing homes, and then people who are essential to maintaining society. So, for example, people who drive buses and trains, people who work in grocery stores and are essential to the food supply, teachers and people who work in schools. So these are the people that we think are most essential to being vaccinated first. We recognize that everybody, eventually, we hope, will agree to be vaccinated. It's not a question of whether people get vaccinated. It's really a question of who gets vaccinated first in a period of time when there is limited amounts of vaccine.